Okay, so welcome everybody to our Coffee and Conversations Careers in Public and Global Health chat. I'm Patty Moran. I'm here from the Center for Career and Professional Development here at Sacred Heart University. I am joined by my colleague, Cicely. Cicely, give a little shout out for yourself.
Hi, I'm Cicely Paggi-Gedect. I'm the Associate Director here with the Center for Career and Professional Development, working with many of you here, as well as our nursing and exercise science undergrads.
Thank you so much. Professor Gunther, you want to take over?
Sure, I am Professor Christina Gunther. I'm a clinical assistant professor in the health science program. I also direct the program as well as the director of the Global Health Programs Office. And I am thrilled to be here today. Thank you for organizing this.
Thank you so much. Professor Penley, I lost you. Where are you?
She's there.
I'm right here. I'm over here in the square.
You want to take a moment to introduce yourself?
Sure. Hi, everyone. I am Sophia Kurdumi Pendley, and I am a clinical assistant professor in the Department of Public Health at Sacred Heart University. I mainly teach in the Masters of Public Health programs. And I am also in charge of our applied practice experiences for our students.
Great, thank you so much. And for my students, if it helps, if you go to the view option, because there are so many of you, which we love to see, if you switch from gallery view to speaker view, you will be able to see who is speaking currently rather than trying to play a guessing game as to where the boxes are. Professor Penley, can I pass it back over to you to introduce Amy Davis?
Sure. Okay, hold on one second. Okay, we are good here. So it is my pleasure to introduce Amy Davis to the group. Amy Davis is a nonprofit leader who believes that collaboration and creativity are at the core of all successful interventions and programs. In her current role, she is the executive director for Unisight and is responsible for global health education and healthcare delivery divisions and coordinates the annual Global Health and Innovation Conference. She is passionate about identifying and implementing innovative, locally based and sustainable interventions to improve health and well-being. Prior to joining Unite for Sight, she worked at the VA, Connecticut in pain research, informatics, multimorbidities, and the Education Center of Innovation. At the VA, Amy coordinated 2 multi-site hybrid studies that assessed the effectiveness of clinical interventions that were designed to improve chronic pain management. She also has experience working as a business litigator in Chicago and as a global health consultant in New York, where she worked on a wide variety of projects focusing on immunizations, malaria, eye diseases, neglected infectious diseases, and reproductive, maternal, newborn, and child health. These projects included research, writing, decision-making on behalf of both NGO and industry clients. And she is very accomplished and published with a number of research papers, and wrote a section on immunization for a leading global health textbook. So she is also, on top of all of her many accolades, she's also an attorney in 3 different states, which is incredible. And serves on the board of directors of Make the Minute Matter Incorporated. So it is my pleasure to introduce Amy Davis to the group.
Thank you so much. Amy, could you give a wave?
Thank you, Sophia.
All right, so now up next, Professor Gunther, do you want to introduce Darcy?
Yes, thank you. So it is my pleasure to introduce Darcy Lynn Cobbs-Lomax, who is the Director of Community Connections and Social Impact for Yale New Haven Health System. In this new health system role, Darcy is tasked with developing a system strategy for addressing health equity working to establish new community connections and partnerships, and measuring the impact of health system programs in the local communities served by YNHHS. Darcy is a native of Bridgeport, Connecticut, and she received her bachelor's degree from Florida State University in French with a concentration in finance, her master's of business administration degree from Georgia State University with a concentration in personnel and employment relations, and her master's of public health degree from Walden University with a concentration in community health. Darcy's 18-year career spans public health, human services, and hospital administration in various roles. Darcy is married and a mother of 4 children, so I don't know how she does all of this. In addition to her work in health equity, Darcy volunteers as a Girl Scout troop leader with the Girl Scouts of Connecticut. She is a member of Jack and Jill of America and Alpha Kappa Alpha Sorority Incorporated. In her free time, she enjoys spending time with her children and sewing. Oh, wow. Welcome, Darcy. It is our pleasure to have you today.
Thank you.
Thank you, Darcy, so much. And thank you, Professor Gunther. Okay, on to Megan. Just to find you on the screen. Okay, perfect. So Megan Adornato, I apologize if I mispronounced your last name, but I tried my best, is the Senior Vice President for Global Health Promotions Programs at Citi. With a decade of experience in worksite health promotion, Megan has a depth of knowledge in implementing strategic health promotion programs for large global institutions. Megan has been in her current role at Citi for 10 years, where she is a key player in the development and implementation of Citi's global wellness strategy. She is responsible for developing Citi's global health promotion programs that are implemented across the organization. She acts as a consultant in 2 countries and regions as they develop their wellness programs, and spearheads collaborating between various departments such as benefits, fitness, dining, corporate reality, and global public affairs to continue to expand awareness of Citi's wellness priorities. She has expertise in chronic condition prevention, employment engagement, strategic planning, health promotion programming, program planning, and implementation. Megan has a Master of Science in Health Promotion Management from American University and a Bachelor of Science in Human Movement from Sacred Heart University. In addition, she has been a part of a variety of industry panels with the New York Business Group on Health and the Employer Health Care Congress. So, welcome, Megan. Thank you for joining us. And then last but not least, Professor Penley, do you want to introduce Gabrielle?
I would love to. Hey, Gabby.
Hi, hi. How
Hi.
are you?
So Gabrielle Diaz is no stranger to me. She has a Master's in Public Health and is a certified health education specialist. She is a 2-time Sacred Heart alum who received both her undergraduate and graduate degrees at SHU. She graduated in May 2018 with her bachelor's in health science, and then again in May 2020 with her master's in public health. During her time in graduate school, she did a number of different things, one of which was as a graduate assistant. She helped to implement a campus-wide intervention against vaping, which led to SHU's campus being tobacco and vape-free. She also did her applied practice experience that focused on vaping education and awareness for the town of Stratford for the Stratford Health Department. And she now works at the Naugatuck Valley Health District as their public health educator. So it's so good to see you, Gabby, and welcome. Welcome home.
Yeah. Thank you. Thank you for inviting me to be here today. Thank you, Sophia, for the introduction. It's so nice to see your face.
I know.
Yeah, it's a pleasure to be here. I'm excited. So thank you for having me.
And thank you very much. And so here's the structure for the remaining part of the event. The first 3 questions are really dedicated towards you getting to know our guest speakers more. So the first 3 questions, we would invite that all of our 4 guest speakers answer the question. And then after that, during the Q&A with the students, feel free to answer as many questions as you'd like or as little, depending on what speaks to you personally. So Professor Gunther, can you start us off?
Yes, I'd be glad to. Thank you. I was hoping that each of you could describe to us a typical work day and help us understand exactly what you do each day. What's it like?
Amy, no pressure. I'm going to make you start.
I'm happy to start. That's a little bit of a trick question. I think I would be lying if I said there was really a typical day. I think part of being in a nonprofit like I am is the need to kind of pivot and, you know, come in every day fresh, ready to see what's in your inbox. I think, you know, we do work kind of a typical day, and we often interact with our clinic partners. We have clinic partners in Ghana and Honduras and India. Those might be WhatsApp messages on my phone, on my, you know, in the morning before I leave for work, or emails throughout the day. Our work is very kind of cyclical. So we have volunteers who go in country all year round. So we're always working with volunteers, but we also have, for example, our big conference in 3 weeks. So this time of year, we're really focused on that. And trying to think of what else. It's we always have sort of long-term projects and goals, because we're always trying to expand, for example, the educational offerings that we have. We're always developing webinars and working on certificate programs and things like that. And then, you know, we deal with the things that come in literally in our inboxes every day, kind of as they come. So for example, somebody might offer to donate ophthalmic equipment to one of our clinic partners, and we might really have to focus on that for a while to sort of sort that out for them. So I don't know if the others, I suspect, maybe have more typical days that we can talk about, but that's what our day looks like. Every day is a little different, but it keeps us on our toes. It's good.
I'm certain this will be the most challenging question.
I think so.
And Amy, just if I can interject, many of our students here today have participated in a lot of the learning on Unite for Sight. So grateful for that. We use that in our Intro to Global Health class. It's wonderful.
Great. And I'm actually going to use this as a little plug. We have an internship in our office, and Holly was one of our interns from Sacred Heart last summer. And so that's something that people can think about, but they're part of our team, and they can experience our typical day if they want.
Fantastic. We love internships. Remember, health science students, you can take them for credit.
That was a great plug. See, students, it's already benefiting that you came today, right? Darcy, do you want to go next?
Sure. So, you know, there were typical days before COVID, and certainly typical days now. I work for a large health system, and so I am normally at Yale New Haven Hospital. I've worked both physically with an office at the hospital and at outpatient sites. So typically I'm at home today. I worked from home today. I have the option of working from home or in the office. I have staff that are at Bridgeport Hospital and at other locations. So my time sort of circulates between home, Yale New Haven, Bridgeport Hospital. Many of you, when you think of rounding, you probably think of rounding with patients, but we are encouraged as leaders to round with our staff and to check on them. So I spent a lot of time at Bridgeport Hospital last week with our community health worker team, who are really too busy to spend any time with me, but I like to pop down to see them. So it varies where I am located. I do sit in a lot of meetings, more meetings now than ever before because of Zoom. I used to have a lot of travel time factored into my day to get to and from meetings. So I miss that sort of downtime in my car going between meetings, because now I just leave one Zoom meeting and go to the next one. And I miss a little bit the human interaction. So I do enjoy the opportunity to be in the hospital. I get a certain amount of energy from being physically at our health system buildings and seeing patients in the lobby, and my colleagues who are also my friends. So it really varies from in the office. Because my job involves the community, I get to be out at community sites, whether it's our COVID testing sites or vaccine sites or with other community partners as well. So I like the nimbleness of my role to be able to kind of move around and be in different cities, really how I design it. I get to really have that flexibility. So I'm really grateful for that.
Thank you for sharing. Megan, you want to go next?
Sure. Hi, everyone, and thank you for bringing me to the panel. So like Darcy and Amy said, you know, my typical day is not the same every day. So I work for Citi, a large global financial institution. And so I think it's helpful to sort of tell people, like, what does that mean? Like, what does corporate wellness really look like? And so for us, one of the things that I for sure had no idea existed when I was a student at all, is that within large global institutions, there's medical directors who are physicians and internists and drive a lot of wellness programs through medical data. And at Citi, we have a medical department, we have a chief medical director who is who I report into. And I'd say that if I think about what I'm working on now, post March 15th of 2020, when life changed, is that right now our team that's filled with public health professionals. So our health promotion team is myself, and I have 2 people on my team. All of us have master's degrees in health promotion and public health. We focus now on COVID-19 vaccine education campaigns for our employees, and we're focusing on mental health and well-being. If I think about the pandemic, it's definitely shined a light on mental health with not only people in the workforce, but everybody sort of grappling with life changing very quickly. Everybody being home. I mean, we all just talked about March 13th of 2020 was my last day in the office. And here we are 1 year later, and I haven't left my house to go to work. And it's crazy. And, you know, our medical director is doing some very exciting things around vaccine education and COVID testing to get our employees back in the office. And we make a priority to educate our employees on the variety of benefits that are available to them, whether that's around, you know, exercise, sleep, nutrition, physical therapy, you know, whatever it might be, mental well-being. And we do all of our employee-facing programs. So anything that's a high touch that shifts behavior change to help people take an action to thrive in their daily life. And what I think is so interesting about working for a big company is that we have every demographic you could think of. We're in 100 countries. We're in 38 states across the US. So sometimes people think about corporate health as only being for a certain type of population of a person. And sometimes that's true. But when you have a big company, you can think about you're developing wellness strategies that work for the high wealth achievers in investment banking and the people that are in a retail branch that are tellers or working in call centers answering the phone when you call and complain about your credit card. So their demographics vary a lot, which is kind of exciting and not something that some people always think about when you work for a company.
Thank you so much. Such a different perspective, right? Which we love. So Gabby, can you round us out?
Sure. So I have to agree with the other speakers when they say that there's no such thing as a typical workday, especially with everything that's going on with COVID-19. Every day is a little bit different. For me and what I do, I actually was hired during the pandemic. So I haven't had an experience of what a typical workday would look like. But what I can say is right now, with all of the different health departments and health districts in Connecticut, they kind of want us to not completely forego what our typical duties and responsibilities would be. And we have to tailor all of our work towards COVID-19. So right now, what a typical workday would look like for me is I am calling and scheduling appointments for people who are eligible to receive the vaccine. Not only first doses, but also second doses. We do a lot of, reaching out to people, making sure that they are well educated, they know what they're getting into, what they want to do when it comes to terms of the vaccine. We run clinics twice a week. Now they're more like 3 or 4 times a week because of all the teachers and daycare and educator personnel that are currently eligible to get vaccinated. So we are focusing on that sort of demographic to get them all vaccinated. And it's a lot of behind the scene work of, you know, scheduling those appointments and making sure that everybody can get to the appointments on time, and, you know, also joining state calls, you know, 3-4 times a week. We work very closely with the state. And yeah, I would say that's pretty much, you know, with COVID-19 right now, that's a big part of what I do, is just organizing the clinics and making sure that everybody who can get vaccinated can get it if they want it. I enjoy it because I get a lot of FaceTime with people. It's nice to be back out into the community. Yeah.
Thank you so much. So we're going to jump right into the next question. Professor Penley, do you want to take us on to the next question?
Yes, I would be happy to. Okay, here's another big question. What made you want to get into this field? Or how did you end up in the position that you are currently in?
And just for the sake of staying in the same order, so it's predictable, Amy, do you want to start us off?
Sure. I think I have a little, well, it was interesting listening to other people's backgrounds. I think we all kind of have our own journeys, and I would definitely encourage students to think about it that way. I was an attorney, a litigator in Chicago for years, and I thought that's what I would always do. And then I had my second child, and I sort of realized that I couldn't be the lawyer I wanted to be and the mom I wanted to be at the same time. And I took a break, which wasn't really a break for anyone who has little kids. And I was fortunate to be able to do that. And in the meantime, our family moved, and I kind of had an opportunity to rethink you know, what I wanted to devote the next 30 years of my career to, and it was global health. And I kind of came to that conclusion by thinking about what, you know, the books I was reading and the things that I was sort of drawn to, and was fortunate, you know, we're fortunate here in Connecticut because we have great schools and opportunities to get an advanced degree if you want it. And so I was, you know, I went back to school and got my MPH, and was a consultant for a few years until this role opened up. And I learned a lot by being a consultant. I don't regret that at all. And I loved the organizations that I worked with. But I knew that I wanted to be on a career path. I wanted to be at an organization where I could grow. And that's not what consulting is. And so I've been at Unite for Sight now for 4 years, and it's been wonderful. And I really believe in our mission. I think that the way we do it is sort of unique. And I have an opportunity, like I said before, to work with interns and volunteers and get to know other people in the field. And so I've been very fortunate. And I think this field is global, speaking of global health, but public health as well. I think there's a lot of innovation going on right now. There are jobs, there are lots of exciting things happening, and it's a really cool place to be. So I'm really happy to see this wonderful turnout for your session, because I like to think that lots of students are as interested in these things as I am. Thank you.
Thank you for that. Darcy, you want to jump in?
Sure. So when I saw this question, it made me realize that this year I've been out of high school 30 years. So this is my 30th year since I left Central High School in Bridgeport and went to Florida. I went to college originally as a mathematics major. Ultimately, those aren't the degrees I got. They were French and finance. And I worked in banking as a corporate lender for a bank in Georgia, lending in an agribusiness division, so very rural places. And I remember telling my parents, I might have been maybe 24, that I wanted a career where I felt like I was doing good for other people, right? And not just necessarily making money for the shareholders or even my own bonus. And I didn't know what that would look like. So unlike some of you who probably have known maybe for years what you want to do, I did not have a career path plan when I was 17 leaving high school. When I was 21 or 22 working in banking, I still was not clear or sure. I landed in healthcare kind of as a fluke. I took a job as an interpreter with a WIC program in the South Bronx, and decided from there I wanted to learn the business of healthcare, just based on what I had encountered at this one clinic. And I've been really fortunate to do a number of things, both in health and human services, along the way over the years. My current role, I really was able to craft myself in some ways. There were some gaps that I saw in the work we were doing as a health system. And so I just started talking to senior leaders and saying, why don't we do this? Or why don't we do this, that in the community? And ultimately, over about an 18-month period, was able to create this new role that I moved into last March 1st, which is not what I had envisioned, because March 1st, a year ago, we were walking into a pandemic. But I've still been able to do really impactful and meaningful work over the past year in my current position. And when I look back on the past maybe 20 years or so of continuous work time, I'm pleased with the things I've been able to do and the unique opportunities, that I've had, and some of the risks that I took. I'm not a huge risk taker. I like things to be sort of planned out and spelled out in life. But I did take a few risks that have landed me in some really cool and fun spaces over the years. So I encourage that from all of you as well.
Music to my ears. Risks definitely pay out sometimes, for sure. Megan, go ahead.
I would say my journey, and that was a nice way to position it, Amy, because it definitely was a journey for me. So I graduated from Sacred Heart in 2006. So at that time, there was not a master's program in public health. But for me, to land to where I got today, it was a lot of a process of elimination. When I started, I always was interested in health science. I started as an athletic training major. I moved to physical therapy. Then it became cardiac rehab, to then go back to maybe a biology teacher. And that did not last for long at all. And then I started having a lot of internship experiences. And along the way, that's what helped me narrow in on what felt like something that felt good to me, which might sound silly, but it was like a gut feeling, like this feels good. This feels like what I want to do. And it happened when I was interning at a corporate fitness center with MediFit, who's now Exos, in Stamford. And I didn't necessarily love being in a fitness center, but I liked the environment of being in a corporate program. And so from there, I sort of thought, okay, I'm a senior. I don't know what I want to do, but I know I kind of want to do this. And I was lucky to find the master's program at American, which helped to give me even more experiences around the broader perspective of health promotion, which is a lot of what, your curriculum now talks about with, how Sacred Heart has, added all these great programs. And from there, I sort of honed into, similar to what Darcy said, is like, I really liked helping people. And I just had more experiences, and I felt like corporate health was right for me, because and what I love about my job today is that we have the best jobs at Citi. Like, we work for a big bank and people are stressed like crazy, and they come to us and they're so thankful, whether you're our senior leaders or our low level employees, they're grateful. They're so grateful for everything that we do for them. And it makes, my 10-hour days sometimes worth it, because I know that I'm doing something for them that's helping them feel like they can thrive and feel like they can get through every day. And I'd say the one thing that was big for me is I just said yes to every opportunity along the way. Before, when I graduated from my master's, it was 2008, which was the financial crisis. So like, good luck finding a job in 2008. I landed back at that corporate fitness center, which is not where I wanted to be, but I knew that I had to start somewhere. And I was so lucky that my manager at that job is the one who referred me to the job at City, which was luck and shows how great of a person she was, because I left her to work for City. But, you know, I just kept trying to sort of get to where I wanted to be and just look for opportunities. And I'm just really grateful for where I landed. And I'd say, you know, the pandemic has been so interesting. You know, wellness at City has always been really important. We're one of the companies that's had a wellness program for 30 years, even more, which is big for, you know, big companies. But we've always been there. Our programs have never been cut, but now we're like the most important part of our company. And I was able to hire somebody on my team in September. Like I've never been able, it's like really hard to hire people sometimes when you're not revenue generating. It's like, well, maybe you could get another team member, but we were so overwhelmed with so many requests from leaders and businesses to offer programs to our employees. And we just literally couldn't keep up. And it was so great that in the middle of this big world crisis, we're adding people to our small team. And it's really positive, I think, for people going into the field, that it's getting bigger and it's becoming even more, you know, like it's not a nice to have, it's a must have now.
Well, I'm glad they're prioritizing you. That's all that matters, right? Gabby?
Yeah, so I think what exactly made me want to go into this field, when I was in school, I was originally going to for my bachelor's in occupational therapy. And there was one day where I just woke up and I decided that that's not what I wanted to do anymore. So I was kind of at a loss almost, and I didn't know exactly what I wanted to do. But to second what Darcy was saying, you know, I wanted to be in a career and I wanted to do good, you know, do good for other people. That was something that I've always grown up wanting to do, is just doing good and helping other people out. So I knew that this realm was something that I needed to look into. So one day I went to a graduate program, just kind of like an info session, and I stumbled upon public health at Sacred Heart. And it was there, it wasn't anything official yet. It was something that was going to be happening in the next year or so, or 2 years. And when I found out about the program and I met the career, it just turned out to be a perfect match for me. And doing the classes and having not only Anna, but also Sophia and Dr. Varela, who's not here, but it changed my whole perspective on life and what I wanted to do. Yeah, and I will say, one of the most important things and why I wanted to do it, it's totally it's a feel-good career to be in, especially in our world today. I think people appreciate more what public health, what the career is and what we do.
Absolutely. That's a great way to end that and segue into our next question. And I know a couple of you've already mentioned this, so certainly if you've already spoken your piece, please don't feel like you have to reiterate what you already said. But if you feel compelled, Professor Gunther, do you want to ask the next question?
I will, yes, but I also just want to comment on what wonderful journeys you've all had, and thank you so much for sharing them, because I think students become very nervous when they suddenly feel like, oh, I don't want to do this anymore, or I'm not sure what to do. So thank you all. And as Megan said, say yes to experiences and open yourself up. You never know. So thank you. So yeah, I was going to ask you how the pandemic affected your work, but most of you commented on that. So maybe instead, let us know how you feel your field of public health and global health and what you do exactly within the field has changed. And do you think that's a permanent change, or will things go back to the way it was prior to the pandemic? And Amy, do you want to start?
Sure. I mean, that's a really big question. It's a great question. I feel like there's so much focus on COVID-19 for very good reason right now, that one of the things that I think about a lot is all the other things that people get sick and die from, or, you know, or suffer from, and, you know, that aren't getting the funding, aren't getting the attention, aren't getting the research dollars. And so I guess I feel like there are people out there like Raj Punjabi, who just took over the malaria initiative for the Biden administration. Like there are big voices that are speaking to things like chronic disease and you know, other health conditions that we all need to be concerned about. And I'm thankful for that, because I think we do need to get back to that, because, you know, those conditions aren't going away, and neither is poverty, and neither is hunger, and, you know, the things that we all care about that brought us here today, and into our fields, in the different capacities that we work. So, you know, that's sort of my hope. I know, you know, in my world, you know, we have partner clinics in Ghana and Honduras and India, and they're all, you know, waiting for the vaccine. It's low and middle income countries. They're not getting it as fast as, you know, high income countries like the US, and it could be years. And that really makes a, you know, has a huge impact on their ability to see patients, to do outreaches. You know, we had to pause our volunteer program last year. We have people in the field now, which is really exciting. And we're sort of, I look at it as sort of rebuilding, though. It was a long pause and a painful one. So, you know, I am optimistic for the future. I think that things like being able to meet by Zoom are wonderful. I think they make the world a smaller place, and they enable us to have these conversations. But I also would sort of flag the fact that lots of people don't have internet still, and we sort of take that for granted. And so, you know, the conversations that we have don't actually include everybody. So I am optimistic for the future, and I think that we've all learned a lot, and I hope that we build on what we've learned and then go back to priorities that we had prior to this as well. How's that?
That was perfect. Does anyone else? Oh, Darcy, go ahead.
Sure. So, you know, I work for a very large health system that spans the shoreline of Connecticut, and we have a hospital in Rhode Island. Things certainly changed in COVID, and in some ways favorably, despite, you know, the tragedy of a world, you know, of a pandemic. In particular, you know, a lot of the things I talked with leadership at the hospital about before COVID around health disparities, they didn't totally fall on deaf ears, but COVID really has brought to light for many, you know, the significant disparities that exist, many of which Amy just discussed, you know, lots of chronic disease management, lots of other illnesses that really need to be addressed, including, you know, poverty and, you know, structural racism and all the other underlying things that exist in our communities and in our nation that affect health outcomes. So COVID has really brought that to light in a very tragic way, but a way that hospitals and health systems are really taking note of and making significant changes to try to address. So that's how I would say things have changed. We're really fortunate at Yale to have a woman, Dr. Marcella Nunez-Smith, who works at Yale. She's also President Biden's the lead for his COVID and health equity task force. So she's actually on a steering committee with me. So having her voice here and being able to say, here's what we think, and here's, you know, I've said many times, can you tell President Biden? I don't know if she tells him the things I say, but I'd like to think that, you know, she said, my colleague Darcy back in New Haven thinks blah, blah, blah. I have no idea, but she's been a great resource for us, not just for New Haven, but for the state of Connecticut. So I think that we will see shifts in how health systems and health departments and the role of public health in addressing health disparities in a pretty significant way in years to come. And I hope that, you know, funding, whether it's NIH or CDC or other funding, comes along with it.
I would say, you know, if I can think about what, you know, the one big thing that's changed, which I touched upon a little bit, I think the pandemic has broken down some of the barriers for the corporate world to talk about mental health. And it's a big deal. You know, mental well-being is, it's essential. You know, if you're not good up here, you're not going to do all the things we tell you to do, right? If you're not feeling right up here, you're not going to eat or well, sleep, exercise, you know, socialize with your loved ones, be present, be happy. You know, it all starts from up here. And it's really what I've noticed at City is it really broke the barrier. It just sort of exploded it where, you know, for the longest time, we weren't even allowed to say the word stress because it was perceived as we as the employer are stressing our employees. And, you know, we've shifted a lot over the last 10 years, but now, you know, I can't even, there's the amount of business leaders that come to us around, can you do a session for our employees on anxiety? Can you help give my manager tools on how to talk to their employees that they're concerned about? You know, and we recently did something for our young analysts who are people right out of college and MBAs who started a job from home. You know, much of what Gabby was saying, like it's a weird way to start your career, like at home, never meeting your coworkers, and that can have an impact on how you feel like you can be productive. You don't know your manager, you've never seen them except for in a box. And some of those things won't change from a corporate perspective. You know, for us, you know, I work in New York City in a building of 15,000 people. And I can tell you that we're not going to be 15,000 people in that building for years. Like, one, because people aren't going to want to go back, because work-life balance has become work-life integration. And it's a priority for people joining a company to feel like their business and the company they want to work for values their priorities for themselves. And I think that those things will stay as part of corporate wellness. And I think from a, you know, strategic side of what we do, I don't think we've seen the full effects of COVID. I mean, they're talking about people who are in the ICU. You know, 30% of those people 4 months later can't even walk on a treadmill for 2 minutes. And there's so much research going into how you can even rehab those individuals to get back to a normal life. And while you may think, well, you know, that's a rehab center, has nothing to do with us, but what if they're your employees? If those people work for you, it's your, as a big employer, you figure out how to support them. Are we subsidizing through our benefits plans the coverage for those rehab centers? Are our disability covering those people to still be paid while they're recovering? So there's a lot of things that you don't even think about really affect how the wellness strategy and the benefit strategy will work, you know, just in the field of corporate wellness. So it's just, you know, it'll be interesting to see, but I think it's $1 million question. What will happen 6 months from now? Nobody knows. No one knows. I wish we did, right?
If only we had a crystal ball.
Yeah.
Thank you so much for that. Okay, so we'll move on to the student portion. So students, like I mentioned in the beginning of the session, we do encourage you to ask questions because we want to make sure that you have enough time to ask questions that may pertain specifically to you or to the group. It could be either or. So you can use the chat function and just write the word question if you want to be unmuted, or if you prefer, you can just ask your question directly in the chat box and Cecily will be able to ask on your behalf. And so we'll just take a minute for you all to reflect on something that you may want to ask our panelists. But I'm feeling very inspired. You are all so inspiring, and your journeys thus far are tremendous. Okay, so go ahead, Alyssa.
Hi, everyone. I'm Alyssa. I'm a senior this year, so I'm graduating. So a question that I have is, what recommendations do you have for a student that's anticipating going into this job field? Because obviously we just talked about a lot of changes and a lot of unknown going forward, but like, I guess, what kind of mindset or personal like anticipations would you have going forward, and like how you can set yourself up for success given the uncertainty of the current situations?
Thank you. Panelists, feel free to jump in.
I mean, I would say for myself, and Alyssa, I'm not sure, you know, if you have an area that you're interested in going into, but I think sometimes your first job might not be your perfect job. And I think like that's just something that you have to sort of accept, that, you know, it can be a journey. It can be a journey by choice or a journey by just life happens. And I think that opportunities can come up. And I'd also encourage, you know, to look into different networking opportunities. There are a lot of health groups for different, you know, like for example, for corporate health, there's the business group on health. There's, you know, different networking and conferences that you can go to meet people, that can help you just even think about where you can find a job or what different jobs look like. So that's something that I would share.
Thank you.
To second what, oh, sorry, was it somebody else talking?
No, go ahead.
Okay. To second what Megan brought up earlier, I think that it's really important that every opportunity that you get, you should say yes to. Everything that, you know, you can get your hands on doing or participating in something, it's all experience that's going to build up. And then, you know, you can put that all on your resume. And then just, you know, just mentally having all of that experience will be good, and, you know, it'll be better for you in the long run. So I think every opportunity that you get to do something within the field, you should absolutely get your hands on and participate in.
And one other thing I was going to add is be okay with asking for feedback. So when you said, how do I set myself up for success? You know, ask your supervisor, your boss, your peers for feedback. That is something I did not do when I first started working, and I'm not sure why. I mean, I certainly got feedback, but you know, when my staff come to me now and say, hey, Darcy, you know, what do you think about you know, how I'm doing, or this project, or bring ideas, right? You know, I've been out of school a long time now, right? So I look to, you know, maybe I'll say people with youthful energy who are newly out of school, you know, take the things you've learned and bring them to your leadership team or your peers and say, hey, you know, how about, you know, we try this, because, you know, you are, you know, you're the future leader of an organization, whether it's the one you're at now or down the road, but certainly bringing in ideas are always, I think, welcome, and asking for feedback.
I would, I have one more thing to add, kind of moving from what Darcy was saying, which is to ask. I like that idea. I think we're all reluctant to do that. And, you know, even right now, you're still in school, you have a professor who you admire, whose work interests you. Reach out, say hello, introduce yourself, see if you can, you know, maybe they'll become a mentor, maybe they won't, but maybe they will, and maybe they have some ideas for you. Reach out to people who are doing the kind of work that you think you want to do, and schedule an informational interview. I know that sounds horrible, and sorry, career counselors, but we all, you know, I do lots of informational interviews with students, and I think, you know, I like to think it's helpful. They're friendly, they're conversations. People who are excited about the work that they're doing are excited to speak to you about it, and they want to share with you. I look at, you know, we have Unite for Sight has a big global health and innovation conference coming up. Some of you, I think, are attending. You know, if there's speakers there who are doing something that's interesting to you, reach out, tell them, I loved your presentation. I'd love to hear more about what you do. You don't know where things are going to lead. And if you don't ask, you won't get that feedback, you won't get that opportunity, you won't have a conversation where somebody says, let me introduce you to someone. So as hard as I think it can be sometimes, you know, swallow your pride, find that little bit of bravery and just reach out, send an email, or link with them on LinkedIn. That's another one. So that would be my little addition.
Thank you.
Thank you all very much. That was very helpful.
I see we have a question from Karina. Do you want to type it in the chat, or would you like to ask it?
Hello.
Hi, Karina, go ahead. You can ask your question.
Can you all hear me?
Yeah, we can hear you. Can you hear us?
Yeah, sorry, my internet's a little spotty. I was coming back from overseas.
That's okay.
So I'm in the physician assistant program, and I was just wondering what recommendations you would give to medical students and new graduates who integrate better with people who do public health, because I feel that we always get the information told to us and this is what we need to follow, but how can we integrate better doing like more community-based organization work versus just staying in that traditional, you're in the hospital, you're in your private practice, and that's where you practice, so that we can create better health outcomes for patients.
Well, as the hospital employee here, I think there's a couple things that clinical staff can integrate with community. So I think one, where you choose to work will have a big impact on that. So you can choose to work for a large health system like a Yale New Haven or Hartford Healthcare or others, which may keep you, pretty much inside the walls of the hospital. But there's also federally qualified health centers. There's other types of community clinics, there's health departments. So there's lots of other places and spaces that clinical staff can look to find employment. I think it's often very easy to think of big hospital because there's always a job at Yale New Haven for someone, whether you're someone like me or a clinical person. The other piece is there's always lots of volunteer opportunities and opportunities to engage with your community differently. Any large health system has a diversity, equity, and inclusion department or health equity strategy or community health improvement plan. So find out what's in those plans. All nonprofit hospitals create them, and they create them with the community. Find out what's in those plans, who's putting them together, and how you can engage with the community that way. I've had providers, come to me about those plans and ask how they can get involved, and there's always a need or always a space. So I think those are just a couple of things to consider as a clinical person going into a public health space.
The only thing that I would add, again, that people just don't think about as a bank. So we have 10 on-site medical departments that are staffed with doctors, physician's assistants, nurses, mental health counselors. They're on, they're all virtual right now, but they'll be back. And those clinical staff that report up through our medical director are responsible for seeing patients. So they act also as an urgent care, but also as our, our fingers to do wellness. So they might coordinate a session on what is specific for that community. So we have, the population needs for our employees in New York are different than people in San Antonio, Texas. So we have different clinicians that will deliver stuff differently. So like Darcy said, sometimes you just don't even, and I had no idea until I worked at City that medical departments existed, like ever. I had no idea. And I was like floored when I interviewed, and I was like, why am I in a doctor's office? It's just, there's just things that you don't even realize are opportunities. And it can just take time, which might sound frustrating, but like the more you sort of talk to people and just, you'll just notice more opportunities that might help you narrow into where you want to end up being.
Thank you. Karina, that was a great question. I appreciate you sharing. Any other students? Do you guys have questions?
I had a question.
Sure. Go ahead, Sabrina.
So my name's Sabrina. I'm also a senior. So since I'm a senior, I've learned many lessons throughout my college experience. So my question to you would be, what would be something or like a lesson you learned now, like in your job fields, that you wish you known when you were a student in college?
And that's going to be hard to narrow down. They're all trying to narrow it down.
I think for me, it's really about the patients. Like, I think I really hoped to find my dream job right away, and it just didn't happen. And I think at first it was really frustrating. And it took a lot of it took me to really change my mindset around like not turning down something that's not perfect and accepting that I'm not going to start where I want to start. And that it's, I've been at City for 10 years. I've worked in the field for 13 or whatever, 14, something like that. And, I love my job and where it is, but it's taken me a long time, even within City, to get my job. Like now I am at like really where I always wanted to be with managing global programs. And it's taken time. And I feel like I had to accept that.
I think I would add that when I came out of undergrad, you know, I told you I worked in banking and I was good at it, but I didn't like it really. I didn't like it enough to be out at pork processing plants, to be in rural spaces, even though I was lending large sums of money. And um, I had an urgency in my 20s to be in the right space, kind of what Megan is saying. And I never took time to think, you know, gosh, if I work till I'm 65, that's 40 years, right? That's a long time to do a lot of different things. And I wish I'd thought about that in my 20s, because I think I spent a lot of my 20s with some anxiety about, let me get a graduate degree and let me get to, you know, the right job and where am I going to be in my life? I want to buy a house, you know, and by the time I got to be early 30s, I kind of settled down. I realized I can get married. I realized I can have 4 children, that I can have a life, and I can still, you know, have a career that would progress at a pace that was good for Darcy. And I had to learn not to get caught up with what my friends were doing, because once I got an MBA, like all of my friends wanted to be the CFO or CEO of a company. Like they had really big plans that I felt myself sort of being sucked into, as opposed to being, let me just really be true to Darcy. What makes sense for me? What do I really value? What are my values, right? And what do I want to do with my life? And I think when I kind of turned that corner, I felt like I suddenly could breathe a little easier, you know, and you know, and I always tell my kids, I say, you know, I can only live Darcy's life, like my daughter Corinna, you can only live Corinne's life. So Sabrina, you can only live your life, and that's not going to look like Danielle's life or Alyssa's life, right? So I think if someone had told me that when I was your age, it might have saved me a little bit of like therapy and like sleepless nights in my 20s.
I will even say this is like great advice for me because I was just a student last year, 2 years ago. So I'm like taking it all in. To kind of add what they both said, I think it's really important to remember, you know, you are on your own path. Don't compare yourself to other people and where they might be within their career path. You know, everybody, like, I think one of the big things for me was when I was in school, a lot of my friends were different majors. And a lot of them, you know, didn't particularly have to go, you know, continue their education after their 4 years. They found a job that they really liked before they even graduated. And you know, you know, you can't help it, but sometimes you compare yourself to other people. That's just kind of what we do as humans. But I think it's important to know that, like, you know, whatever you want to do, just, you know, kind of stick with what you want to do. Don't change your mind on anything to compare it to anybody else. And yeah, everything happens for a reason. I'm a firm believer in that. And it is, you know, it is not just a short-term thing, it's a journey that you have to go through. So I would say just, you know, live in it. Don't yeah.
Yeah, I guess I totally agree with what you're all saying. And I think part of it is, it sounds to me like, you know, sort of be compassionate with yourself, be patient. I also think that oftentimes the things that we do early in our life that don't seem like they're building, like we're trying to create this narrative of what our career is going to look like. And, you know, what I've found, and I think my career might be a little longer than anyone else's on this panel, is that the things that may not have seemed relevant at the time, or they did, the things that you learn along the way, life lessons, not just sort of academic or you know, really practical lessons, those can be the most valuable. And it turns out, you know, even coursework that you think, like I had to take 2 semesters of biostatistics, and I thought, all right, I'll do it because I have to graduate. But now I use it. I don't, you know, I don't need to, thank God, do a lot of data analysis, but I know how to read a study. I know how to analyze things, and I know when somebody's skipped a step. And I'm glad that I know that. And I think there are a lot of things like that along the way. And I think I'm trying to remember who said it earlier. I think it was Gabrielle maybe, but that idea that it might not be oh no, I'm sorry, it was Megan. It might not be the perfect job. They're never the perfect job. It's, you know, you want to feel proud. You want to feel like what you're doing is meaningful to you, to others. But I think that there's always something that you can learn from any experience and any kind of job. And so if you give it 100%, you'll find looking back that they're worth lessons that you learned, even if at the time you thought, you know, I don't need to be doing this. Or, so, and I also actually, you know, sort of I'm giving myself my own counterpoint, but I think sometimes you think to yourself, in order to get to where I want to go, I need to have XYZ on my resume. So that for me was working at the VA. I knew that I had lots of experience, but I hadn't managed projects. So I took a role, I was a consultant, then I took a role at the VA because that's literally what I did. And I felt like that was a gap that I needed to fill to get where I needed to go. And so anyway, that was part of my journey, but that was later in my career. I feel like with the early jobs that you get, there's just a lot that you can learn, regardless of whether it's, you know, kind of exactly what you think you ought to be doing.
Amy, that was a perfect segue.
Did you like my own counterpoint? Do you like that I provided my own? That's the lawyer.
I love that. You know, it really was just, you know, tremendous advice, honestly, from all of you. And for the sake of time, students, I'm going to give you a homework assignment. So if you are eager and interested to continue the conversation with one of our esteemed guests today, I want you to reach out to them via LinkedIn and ask them the question, which qualities, which traits are you looking for in candidates if you were to hire? And I bet you will gain tremendous insight from doing that. Or if you don't feel like doing that, perhaps you can request an informational interview, because we learned today how valuable those can be. But I do want to wrap up for the sake of time, because I know students, you are battling a bunch of different priorities right now. So on behalf of the Health Science Department, the Masters in Public Health program, and of course the Career Development Center, we thank you all for participating today. Professor Gunther, Professor Penley, I want to give you some airtime before we wrap up.
Yeah, I thank you to all of our guests. It's just such wonderful advice for our students, and definitely, I think, valuable to them and where they are in their lives. And Amy, thank you for pointing out that yes, it's worth knowing how to calculate a daily. They might need to know it. So thank you for that. And just everybody, Megan, we're going to have to add some corporate wellness information to our curriculum to include that. And Darcy, I have you pegged for a guest speaker. And Gabby, so tremendous that, you know, going through the health science program and then MPH, we're of course so proud. But thank you to all of you. Really, really appreciate your time.
So a round of virtual applause for our guests and for our students. Thank you for participating. Have a wonderful rest of the day.
I also wanted to add that, so thank you for everybody, and thank you to Patty and for your help in organizing. And Dr. Gunther, I'm going to put you on here too, but if if you're having other questions or you're wanting to explore, you want to explore Masters of Public Health or other public health kind of fields, I'm here for you, as well as I see Molly's on here as well. So you have a lot of experience and help and guidance within the SHU family already. So I encourage you to reach out to us.
Sorry, Molly, I didn't see you. Do you want to do a quick shout out too?
Oh, sure. Thank you, everyone. This was so informational and exciting, and I'm so excited to see many students that are global health minors on this call. So those of you that aren't global health minors, you might be interested in exploring the minor. Please reach out to me or Dr. Gunther, and we're happy to chat about that.
That's a great plug. Good way to end it. All right. Thank you, everybody. Be well, be safe, and have a wonderful rest of the night.
Thank you.
Thank you. Thank you, everybody.